Cardiac surgeon warns, this drug is damaging the hearts of older adults. The health of your heart is the foundation of your entire life, yet there is a silent crisis unfolding in bathroom cabinets across the country. As a specialist who has spent decades operating on the human heart, I have witnessed a disturbing trend. Perfectly healthy individuals arriving in the operating room with severe cardiac damage caused not by lifestyle or genetics, but by the very medications they trusted to help them. These are not rare or experimental drugs. They are the common pills used for aches, stomach issues, and the common cold. You won't want to miss the final habit or the last tip on this list, because 99% of people will miss it and remain stuck with hidden heart damage for life. This information is a life-saving truth that challenges the conventional wisdom of safe, over-the-counter medicine. When we reach the age of 60, our cardiovascular system undergoes natural changes. The heart muscle may become slightly stiffer, and our blood vessels are less resilient than they once were. This is why the medications we take must be scrutinized with extreme care. The pharmaceutical industry often markets these products as universal solutions, but for an older adult, the wrong pill can be a catalyst for disaster. Many people go through their daily routines popping tablets for minor discomforts, completely unaware that they are essentially playing Russian roulette with their heart health. It is my mission to reveal these hidden dangers so you can protect yourself and your loved ones from avoidable tragedies. The first group of medications that demand your immediate attention are non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. These include the everyday pills people take for headaches, back pain, and arthritis. While they are incredibly effective at reducing inflammation and dulling pain, they carry a dark secret that the medical community has recognized for nearly 2 decades. Regular use of these drugs after age 60 creates a volatile environment for the heart. In fact, regulatory agencies have long required warnings about heart attack and stroke risks on these labels, yet millions treat them like candy. To understand the danger, consider the case of a 72-year-old man who was an avid gardener. To manage his knee pain, he took these anti-inflammatory pills almost every day. Over time, he began to feel drained, his breath grew short, and his ankles swelled to twice their normal size. He wasn't suffering from a new heart disease. He was experiencing acute heart failure triggered by his medication. These drugs block enzymes that protect your kidneys and blood vessels, leading to a catastrophic chain reaction. They force your body to retain salt and water, which increases the volume of fluid your heart must pump. For an older heart, this extra workload is often more than the pump can handle. Furthermore, these drugs can constrict blood vessels and spike blood pressure, even neutralizing the effects of actual blood pressure medications. If you take low-dose aspirin for heart protection, these pain relievers can actually cancel out that protection entirely. The safest path is to use the lowest dose for the shortest time possible, and always ask your physician for heart-safe alternatives like topical creams or acetaminophen. The second hidden danger resides in a class of drugs marketed as stomach protectors, proton pump inhibitors, or PPIs. These are among the most prescribed medications globally, used to treat acid reflux and heartburn. The irony is profound. A medication taken to protect your stomach may be damaging your heart through a backdoor mechanism. Long-term use of these drugs significantly reduces stomach acidity, which is vital for the absorption of nutrients, specifically magnesium. Magnesium is the conductor of your heart's electrical orchestra. Without it, the heart becomes unstable, leading to dangerous arrhythmias. Beyond nutrient depletion, there is evidence suggesting that these stomach medications may reduce nitric oxide levels in the body. Nitric oxide is the molecule responsible for keeping your blood vessels flexible and dilated. When these levels drop, the vessels can harden, setting the stage for a heart attack. Furthermore, these drugs can interfere with critical blood thinners given to patients after a heart attack, making those life-saving medications less effective. These drugs were originally intended for short-term use, 4 to 8 weeks, yet many people stay on them for years. If you are on a long-term regimen for reflux, it is vital to discuss a tapering plan or magnesium monitoring with your doctor rather than stopping abruptly. Moving to the third category, we find a common household staple, oral decongestants for colds and flu. Many of these products contain stimulants designed to shrink the blood vessels in your nose so you can breathe easier. However, these chemicals do not stay localized in your nose. They travel through your entire bloodstream, constricting vessels throughout your body. This creates a scenario where your heart is trying to push blood through a squeezed hose, causing blood pressure to explode. For an individual over 60, these stimulants can push a sensitive heart to the brink, causing racing heartbeats and dangerous spikes in pressure. The danger is magnified because these are available over the counter, leading many to assume they are harmless. If you have hypertension or any existing heart condition, these decongestants should be avoided entirely. Safer alternatives like saline nasal sprays, humidifiers, or localized corticosteroid sprays provide relief without putting your cardiovascular system under life-threatening stress. The fourth area of concern involves mental health and chronic pain management, specifically an older class of medications known as tricyclic antidepressants. While mental health is a cornerstone of physical well-being, the method of treatment matters immensely for the aging heart. These specific medications can cause a sudden drop in blood pressure when standing up, leading to dizziness and dangerous falls. More alarmingly, they can accelerate the resting heart rate and interfere with the heart's electrical impulses, increasing the risk of sudden cardiac events. While newer, safer antidepressants are now the standard for mood disorders, these older versions are still frequently prescribed for nerve pain. If you or a loved one is using these, it is essential to ensure that your heart rhythm and blood pressure are being monitored closely by a professional. Finally, we reach the most controversial topic: calcium supplements. For decades, the message to older adults, particularly women, has been to take high-dose calcium for bone strength. However, recent scientific inquiries have raised a massive red flag. While calcium from food sources like dairy and leafy greens is absorbed slowly and safely, high-dose supplements create an artificial spike of calcium in the blood. The body often cannot utilize this sudden influx for bone health, and the excess calcium has to go somewhere. The primary concern is that this excess calcium deposits itself into the walls of your arteries. This process, known as arterial calcification, makes the arteries rigid and contributes to the formation of plaques that cause heart attacks. While the evidence is still being debated in the scientific community, the risk is significant enough that more is certainly not better. The safest strategy is to prioritize dietary calcium. If a supplement is medically necessary due to severe osteoporosis, it must be a calculated decision made with a doctor who considers your cardiovascular risk profile, not a pill you start taking on your own based on a marketing ad. Knowledge is your greatest shield. The goal of sharing these truths is not to incite panic or to suggest that you should stop your prescribed medications immediately. Doing so without medical supervision can be just as dangerous as the risks described. Instead, the goal is empowerment. You are now equipped with information that the majority of people ignore. You now understand that a simple pill for a cold or a supplement for your bones has a direct impact on the most vital muscle in your body. This awareness transforms you from a passive consumer of medicine into an active partner in your own healthcare. Your heart has worked tirelessly for decades, beating millions of times to keep you moving, dreaming, and living. It deserves exquisite care and protection. When you next visit your healthcare provider, bring a complete list of every pill, vitamin, and supplement you take. Ask the hard questions. Is this still necessary? Is there a heart-safe alternative? How is this affecting my blood pressure? Every treatment is a balance of risk and reward, and as we age, that balance shifts. By staying informed and vigilant, you are making the best investment possible in your future. The journey to a healthier heart begins with a single conversation. Your experiences and your vigilance can serve as a beacon for others. By sharing what you have learned, you could be the catalyst that saves a friend or family member from a preventable cardiac event. Remember, health is not just the absence of disease. It is the proactive protection of your body's vital systems. Stay curious, stay informed, and always put the health of your heart first. Subscribe for more insights into protecting your longevity and health. Which advice will you start applying today?